Okay, so we're going to be doing a Profhilo treatment on Naomi today. Profhilo is a lovely treatment for anyone really, but for Naomi it's really going to boost her radiance and her luminosity. It's really good as well for skin laxity, any kind of crepey issues, and you know, patients really enjoy the benefits of Profhilo because it gives you a really glow. It gives you a real lovely glow. So today we're going to demonstrate that procedure for you today, because loads of patients have been asking, what does it feel like? What's the downtime? So that's what we're going to be doing for you today. So what is Profhilo? So Profhilo is not a filler. It's a hyaluronic acid based material, and it is injected in 5 key strategic points within the face, which stimulates your own collagen production. Over the course of a month, it will spread across your face and really kickstart that glow within your face. If you've never had Profhilo done before, you definitely need 2 treatments as a minimum, a month apart. And then for maintenance, Naomi's here today for her maintenance treatment 4 months later. She's decided that she loves the treatment, so she wants it done as a maintenance every 4 months, as it beats any kind of facial that you can ever have. So we've marked out the key strategic points here, where we're going to inject superficially. It's not that stingy in these sort of areas. The kind of stingy areas may be around here and maybe around the chin area, but it's very, very transient. So, you know, you're totally fine to go to work if you wanted to. When we do the injection markings, they are these bioremodeling points that have been specifically chosen to create the best effect, to help with laxity, help with boosting your collagen, help with your hydration, help with your luminosity, and generally give a really lovely plumping effect, and you know, give you a super glow. So Profhilo is really good for anyone really who's considering any kind of injectable treatment. Some of my patients will come who really don't want any kind of fillers, but just really want a lovely glow and just want to increase their skin quality, hydration, luminosity. Some patients who have fillers done just add it as an icing on top of the cake, so you know, it just gives them a really lovely filter across their whole face, so you don't need to use a filter on your phone when you're having selfies done. Other patients who do suffer a little bit from crepiness as they've aged a little bit and their collagen production has decreased, use it as just a really tightening and firming treatment. So it's got a place for everyone basically. So anyone who's considering injectables, whether they are a filler patient, a Botox patient, or someone who's never tried injectables, it's wonderful for everyone. Okay, Naomi, so we've marked out 5 points on your face on each side, and we're going to start your injectable treatment now. Any issues, just raise your hand. So we're just going to stretch the skin. We're going to go quite superficial. Well done. So you can see that the consistency of the Profhilo, I mean, a lot of people compare it to runny honey, so it raises a bit of a bleb. Now that bleb will take a little time to settle down. With some patients it takes an hour, with some patients it takes half an hour, some patients it can take a little bit longer, but generally, Naomi, how long has it taken you?
Less 3 hours and the
3 hours or so. Okay,
yeah.
fine. Okay, but yeah, we're going to do another treatment now on this side. Well done, you're doing absolutely brilliant. Little pinch, my love. Not too bad.
Didn't feel it.
Well done. Super. Okay, well done. And I think by stretching the skin as well, just creates a bit of tension, so it's slightly more comfortable for the patient. Well done, my love. Feeling all right?
Good.
Okay, so generally most patients find that these 3 areas are not too bad. The slightly more stingy areas are the chin and kind of around the anterior cheek area. So we tend to leave that, well, I tend to leave that to last. So we're going to do that now, Naomi, okay? Well done. How are you?
It's good. It actually doesn't sting. It just feels more like a slight pressure
Okay.
rather than a sting, but it's not uncomfortable.
And I'm just popping a little bit in here now. Breathe in.
Like when you say sting, it's like slight. It's not even like a scratch, or it's you feel it, but it's not. It's not uncomfortable, or it's like a slight.
So if we have a little look now, so we've got these little raised blebs, okay? There's a little bit of redness, that will just take a bit of time to settle, but these blebs will already have started going down as I'm progressing to the other side of the face. Okay, so you can see already on this side, those little blebs have started to go down already. So yes, we're going to do this side. Okay, ready, my love? So another little scratch, breathe in. And yeah, so we just inject, again, like I was saying, the consistency is quite like runny honey. You will get a little bit of a bleb. The Profhilo will sort of spread across your face over the course of a month and kickstart your collagen production. And again, super important with having any kind of injectable treatment that you don't exercise today. No alcohol, and yeah, so no rubbing your face too much. So you can see Naomi's tolerating this quite well. She's quite good. Some patients tend to be a little bit more nervous. We can apply numbing cream, but I think you don't really need it, to be honest. There's just a couple of areas where it might be a little bit stingy. You okay?
Yeah.
So again, the injections are not deep, they're just going into the skin to work on all the skin layers, to really not volumize the skin, but really increase hydration and laxity, and just give her a really lovely glow. Okay, Naomi, we're going to do those slightly stingy ones, okay? Deep breath in, my love. Little pinch. Well done. Well done. Well done. Amazing. So you can see the whole treatment will take around sort of 20 minutes. And there's not really any really major bleeding that goes on. But yeah, if we do actually quickly look at this side here, you can see that redness is already starting to diminish. And last injection point, Naomi. Great. Amazing. Feel all right?
Good.
Okay, so we've finished Naomi's Profhilo treatment now. She's going to go to work. Treatment not too bad?
Not too bad, not painful. No,
All
just
right, great. So over the course of a month, that collagen will literally start bioremodeling. She'll have a lovely sense of hydration, luminosity. She doesn't really suffer from skin laxity, but I think for Naomi, she will just have a really lovely glow, ready for Christmas.